Okay, so here we have the range of motion test for shoulder external rotation. So here the partner is going to be lying supine with the arm abducted at 90 degrees as well as the elbow flexed to 90 degrees. And then there's going to be a notebook placed under the elbow so that the humerus is level with the acromion process. So the axis of rotation is going to be at the olecranon process, while the stationary arm is going to be an imaginary line perpendicular to the floor, and then the mobile arm is going to be aligned with the ulna at the ulnar styloid process. So the normal range of motion for shoulder external rotation is 90 degrees. Here he scored a value of 88 degrees, so he is pretty close to the normal value. So here's the manual muscle test for the subscapularis. So the function of the subscapularis is internal rotation. So to perform this test, the partner is going to be lying prone with the arm abducted to about 45 degrees with the elbow completely straight. And so I'm going to stabilize near the acromion process of the shoulder and then apply downward pressure in the direction of external rotation of the shoulder, and then he's simply going to try and resist my pressure in that direction. So here he scored a value of 5 because he was able to fully resist my pressure, so there was no weakness in this muscle. Okay, so here's the range of motion test for Q angle. So the partner could be standing up or lying down. So for this, I chose to have the partner lying supine. So the axis of rotation is going to be at the center of the patella. The stationary arm is going to be at the anterior superior iliac spine, while the mobile arm is going to be at the tibial tuberosity. So the normal range of motion for this test is 10 to 14 degrees for males, and here he scored a value of 12 degrees, so he is right in the normal category. So here's the manual muscle test for the anterior tibialis. So the subject is going to be seated upright with their legs completely straight, with their feet dangling off the edge of the table. And so for me as the examiner, I'm going to stabilize at the shin, just proximal to the ankle, and then I'm going to apply resistance at the actual foot in the direction of plantar flexion and eversion, because the action of the anterior tibialis is dorsiflexion and inversion. So for this test, the client got a score of a 5 because he was able to fully resist my pressure without any noted weakness in the muscle. Alright, so here's the range of motion test for thoracolumbar side bending. So for here, the partner is going to be standing upright with their arms at the side, feet about hip length apart. So the axis of rotation is going to be at the spinous process of vertebrae S2. The stationary arm is going to be aligned with perpendicular to the floor, while the mobile arm is going to be aligned with the spinous process of C7. So the normal range of motion for this test is 25 degrees. So here the client scored a value of 31 degrees. So he has slightly in excess of range of motion for this movement. So here's the manual muscle test for lumbar trunk extension. So the partner is going to be lying prone with their hands behind their head. The examiner is just going to apply downward resistance near the ankles so that their feet do not lift off the floor during the exercise. And then the client is simply going to erect their spine and extend the trunk and hold that position for a few seconds. So here the subject scored a value of 5 because he was able to fully perform the movement with no noted muscle weakness.